Welcome to Partnerships for Profit, the podcast where we bring you inside the world of joint ventures, strategic partnerships, and powerful collaborations. Each episode, you'll dive into conversations with top entrepreneurs, visionaries, and business leaders, unlocking the secrets to building profitable relationships that drive growth and success. Whether you're looking to expand your network, find new referral partners, or scale your business, you're in the right place. Let's get started.
Welcome to Partnerships for Profit, presented by LeDuc Entertainment. Today we are joined by Dr. Aimee Russo-Mounger, who is the founder and managing partner of the Smile Spa. Aimee, welcome to the show.
Thank you. Thanks for having me. I'm excited.
Can we start off with you telling us a little bit about yourself and a little bit about the Smile Spa?
Well, I am a mom of two boys. My husband and I have been married. It'll be 30 years next year. And I have a 23-year-old and a almost 20. He's going to be 20 this month. And I've been at my own practice since 1999. And then we did we opened up as the Smile Spa in 2004. Gosh, everything is so long ago. That's kind of crazy numbers. But that's when I decided that I wanted to have something just a little bit different. And so that's when it started. And now we're in our new office on Jefferson.
And when clients come to the Smile Spa, what are some of the problems that they're having that you're helping them solve?
Oh, anything. There's all dental problems pretty much across the gamut is what they'll come in for, which is great. They come in a lot of times with some nervousness. I feel like we get a lot of those people just because we say, we are the Smile Spa. We do really try, but I think all dentists do try to, have a very comforting and compassionate atmosphere. We just, I guess as women, we can be a little bit more compassionate sometimes than men. Hate to say that, but smaller hands, gentle, we're used to mothering, so we can easily mother our patients if we need to. Also, everybody here is a woman. I always say we need some more testosterone in the building, but it doesn't happen. It's just full of estrogen. But, nobody really likes to go to the dentist. So I was kind of, after a while, I was like, gosh, I started this profession and I loved my dentist and I had no trouble. He gave me nitrous. So that's why I didn't have any trouble. I took a nap and then woke back up. So I thought, well, this is going to be a fun profession. It kind of wasn't where my plan was taking me originally. And then God just put me in a different direction. And I do love it. But people would just hate. I was like, I don't hate you, but I hate coming to the dentist. I don't hate you, but I hate the dentist. And I was, this is just not. Right. Why do they just hate me so much? Little old me. Why do you hate me? Why are you scared of me? So that's when I said, let's try to make it. And, every lady likes a spa. So you go to the spa, you get the warm neck wrap, and then you get to lay, and it's nice music, and everything's kind of relaxing colors and nothing really crazy. So that's where that all came from, where I felt like when people come in with any problem across the board, like we talked about, and they have any dental anxiety, or what we tell them sometimes gives them anxiety, what they need to have done, we can offer them ways to just kind of calm down, take more time, relax in the chair, give yourself some time, have some mom time, some dad time, just yourself time. Sometimes life is so busy now that nobody really sits alone without their phone, So some people, we have TVs and we have lots of things they can watch, all kinds of movies and music. And a lot of times people just say, no, I'm just going to sit. I'm like, amen. Sit. That's perfect. We have massage chairs in the front waiting room. And so when we're making a crown, sometimes we'll have the patient go sit in the massage chair in the front and they don't want to come back and get their crown. They're like, well, I'm just going to sit right here. We've numbed them in the front too sometimes. But yeah, that was the main goal, was just to try to help people with the overall fear of the dentist. And we say we convert people. We convert them over to our side to where they're like, oh, this is really not so bad. So, that was my main purpose of the Smile Spa. And it's working pretty well.
Was there a specific moment that you knew, that something in the dental practice realm needed to change? Was there like an instance where you knew that I need to do something different?
Probably that first year of practice. When I was out for 6 months, I worked for someone else. And so that's just like you just a fish out of water trying to find your way, when you're first starting. And then I knew, it was like, I don't really want to be in this area. I want to be in a different area of town. And also, I wanted to own my own practice. So it kind of came up really fast, 6 months after I graduated from dental school. And then that first year, that's when you start hearing all the comments. Because I guess in dental school, you don't really hear the comments that people don't like you. They don't tell you when you get out, no one's going to like you. And nobody's going to want to come see you and all this stuff. They don't tell you that. So I think just the comments, being a woman, and we take a little bit, and at that age in my life, 25 years old, you take a lot of things to heart. So it's like, hurt my feelings. Why don't they like me? People pleaser kind of thing that, you are at 25. But I think that's really started it. From the very beginning, I thought, wow, people really don't like coming to this. And it's really not that bad. It doesn't have to be that bad. I feel like people's anxiety a lot of times is way worse than what it could be. Their thoughts of what's going to happen, their thoughts of what could happen are always worse than what really does happen. They tell me afterwards, and as long as you don't have a bad experience and have PTSD, which that's what they come to me with, is dental PTSD for sure. I tell them that. They said, I'm so sorry, I'm the only one like this. I'm like, you're not the only one like this, that needs medication. It's a thing. Dental PTSD, if you had a bad experience when you were a kid or just as a young adult, even or as adults now, the profession as a whole has gotten a lot better at, keeping people comfortable and not as barbaric as I think it used to be. But some of my 60 and older patients had pretty barbaric treatment as a kid. And so that's kind of where that all comes from. So I feel like we can help them.
Can you tell me a little bit more about how you kind of, integrate, skincare and facial aesthetics and all these different aspects of a spa? How do you kind of integrate it into the dental side of things?
So I do Botox and filler, which we feel like, from here up is kind of our place of play. This is where we like to live. And all those things that help that all look better. So we can make the smile beautiful, but then if you just look worn out and wrinkled and, so just exhausted, like most moms can be, a little spruce up is nice. Get your teeth clean and get some Botox, or, get a hydrofacial, get some products, get nice products, we'll talk about vitamins. I kind of just a holistic way of approaching everything. Not really, I say the face, but that's what we treat. But then our face and our head is connected to our body. And so we have to have a holistic approach when we're talking to patients of like medication that they're taking and how their microbiome in their mouth affects all the other things. If you have certain diseases in your mouth, how does that affect your health? And so it's not just about teeth really anymore. It's really gotten to where as a good practitioner, you need to really treat the whole patient and not just the field that you're in, not just the mouth, even though I add the nice little niceties and the pretties with it. Overall, our goal is to make people healthy. And sometimes it is about getting your skin healthy just as well as getting your face healthy and your teeth healthy. Yeah.
What inspired you to get into the dental space?
I said it was God earlier. So I'm going to be a dancer. So I still dance to this day. I love it. So I had a scholarship to go to New York City after I graduated from high school. I got the scholarship while I was a senior in high school. So I shouldn't say this out loud. I played dot to dot on the ACT. I was like, I'm not going to college. I'm going to go be a dancer. So, and then now they have a lot more opportunities. This was in the 90s. I graduated in 1990 from high school. They didn't have near the things that they have now that's available for dancing. I mean, you had to kind of be almost be a Rockette or be on, Broadway, those things. So I moved to New York and that's what I was going to do. And then I came home for the winter. It was cold and I was going to come get more clothes and different things. And I had some aunts that were teachers sat me down and said, why don't you just try to go to school? So went to school. And at this point, I feel like it was just God's taken my head and turned it the other direction. And so I was like, well, I love my dentist. I like medical field. My dad's a pharmacist. So it's like, I knew I would go if I had anything would be to go into the medical direction. And so then I just kind of picked it. It was actually going to the library and you used to have a book, which nobody has anymore, but the book with all the careers and it was in alphabetical order. And so I kind of was like, let me see what I need to make my major. So I can, when I go in, I opened the book up and I got to dentistry and it's like, this would be really cool. I love smiles. I love, making people smile, all the things. I think this would be cool. I'll do biology. And because I'm only going to be here for a little while. I'm going to go back to New York, and then here we are, 26 years later.
Worked out for you.
I'm glad I didn't fight him too much, which I do sometimes, I have to check myself. Let him do the leading. It's always better than my pick. And I get to dance too now. So, there
you go.
Yeah. It all worked out.
Can you walk us through a little bit about how Invisalign and other oral appliances really sort of have the power to change lives?
Yeah, so they've done a great job of getting what used to be just braces. You got them as a kid they're definitely good for function, and we need them for not just aesthetic purposes. But with us having all of these new ways to do just clear aligners, adults can now, people who couldn't afford braces or their parents couldn't afford braces early on, can take care of themselves and not have to be the brace face, the metal braces and stuff. So that has been a great option for adults, is the clear brackets. The clear aligners. We also do clear brackets. So it's like a porcelain color. So it's a tooth color bracket. So if I really need to do a bracket and wire on someone that's an adult, we still don't do metal brackets at all anymore. And even on some teenagers, we just do the porcelain brackets. But the clear aligners work out really well. People can take them out if they have like a really important business meeting, or you're having a lunch date, you can take them out. They just work well for our adult working, environment. But for adults, a lot of times it's some aesthetics, but a lot of times it's function. So over time, everything starts to kind of collapse. And then when everything collapses, our tongue is still the same size. If we gain weight, our tongue actually gets everything, the cheeks and everything can get a little puffier. Well, then there's no room for stuff. And that's when we lay down. That's when we start to get the snoring and blocking our airways and all the things that affect so many other things in our body and our way of living. So the snore appliances are huge. Grinding and clenching since 2020, that was always a thing. We always had appliances for patients to wear. There were always people who did grind and clench their teeth, just our anxiety and things like that. But since COVID, it has just been out the box. I think everybody's life has changed a little bit, and everybody's life's different. And we tend, between all the phones and all the incoming influx of stuff, there's a lot of people that are anxious, and a lot of times subconsciously we take it out on our teeth, clenching, grinding, and then you end up with a lot of pain, a lot of just big muscles and a lot of pain. So we can do Botox in the muscles to slow it down, but that's just a temporary Band-Aid. Wearing something at night to stop you from clenching, grinding is huge. It helps people just be able to function during the day, not get the migraines, not get the headaches, and the jaw pain, they can't open their mouth, can eat a burger, stuff like that.
Yeah.
And then the sleep appliance, that's just, it's out the box crazy that it can help so many people. There's snoring that you're really not getting enough air. You're not getting your REM sleep. So you're not getting oxygen. So overall, pretty much most people know you need oxygen, but we don't think about that's why we're snoring, and we're laying back and we're trying to, we're just trying to suck in air, and it's like, that's how we live. Water and oxygen for sure we need. So the snore appliance is so easy to use. Most people don't like a CPAP, or scared to even go get the test because they know they don't want to wear a CPAP. So a lot of people don't know that this is even out there. And it's an easy appliance. We can get used to almost anything, but I don't think I would wrap myself up in a CPAP. I would be like a cocoon by the time the night was over if I had to use one. But some people do love it, and it works great for those people. But these appliances help people get enough oxygen in, which gives our brain oxygen, and our body, we can use our growth hormone, only functions whenever we get the right kind of sleep. When we get REM sleep, we don't get REM sleep if we're not breathing. Our metabolism, we get fatter from not sleeping, all the things now. And thankfully, it's really coming out there a lot more. We don't have to kind of be the first educators about it, but I do like to educate my patients about it. I do ask everybody, even younger people, do you snore? Do you grind your teeth, clench your teeth? A lot of times the clenching, grinding comes before the snore even. So trying to keep them healthy that way. It's because the snoring, the non-oxygen actually now has heart problems, has been contributed to heart problems, strokes, dementia, and Alzheimer's, which everybody is having some family member that they know has got this new, I say new, I feel like it's fairly new, disease. And a lot of it's from not getting oxygen to your brain. So it gives our brain that time to kind of start to wear down and deteriorate. And then we get these two diseases, which are horrible diseases to have, and nobody wants them, and nobody wants their family members to have them and have to caretake for somebody like that. So I wish I could get out there more, but if anybody has any kind of snoring, or anybody says they snore, don't like they sleep well, they should definitely look into getting a night appliance, which is easy to wear and helps.
It's funny, that sort of psychosomatic effect you're talking about, like, grinding your teeth, clenching your jaw. And I'm sitting here going like, am I doing that right now?
I know. Well, when I work on a really hard case too, I'm like, I ain't clenching my teeth. It's just our way of, I don't know. Our body decides that that's the way to take care of itself. I don't know. Crazy stuff.
Can you talk a little bit about the transformation that you see in people when somebody goes from being not confident in their smile to being confident in their smile? What kind of a, personality shift do you see there?
Oh my God, this is like how you do it. This is why you do the job. You're like, oh, this is the day. This is what I do this for. It takes away all those people that say they don't like coming to the dentist. It's amazing. So, and actually, I have the best story. He would be a great person to just talk to. He is a great guy, and he is actually my front office lady's husband. And tetracycline stain is when your mom takes some antibiotics when you're younger, and it's like these really gray teeth. And so, of course, the color, since he was born, he thought, well, this is just how I have to live. I don't understand why I have gray teeth and nobody else does. And then he had these really small teeth, and then he was a grinder clincher. So he had really small teeth, and then he wore them down a whole lot, and he would never smile. And so I was taking this one course in Iowa. I don't know where I was now that I say that. It was just restoring the whole mouth, making everything back to function. But then at the same time, of course, you get prettier teeth because you're crowning all the teeth. And he looks, when you put the picture next to him of his old picture, and he's a happy guy. He works for the church. Like, he's just an amazing person. But the smile from before and after, he is 20 years younger, just in his smile, nothing else changed. I didn't do Botox. I didn't do any of the other things that we could have done on him, which he didn't need. But, he said, I never knew how it was to really smile because I kept my mouth, I smile with my mouth shut, or very little smile, because I didn't want anybody to see my teeth. I never liked my teeth. And that's the majority of people. They change their smile. You can actually change it. Like, I smile and you see my molars. So it's not like, I go way back here. But some people are like, very small. And when they come in like that, I'm always like, what do you not like about your smile? What is it? And something that I noticed, I have to say, but I've noticed all of it, but something like their spouse may not notice, or their kids may not notice. It affects them, and it really does affect their self-confidence, how they relate to everything in life, what they do, if they're happy or sad. We need to smile. That makes us happy. It physically brings out the dopamine and the serotonin, and it makes us happy when we smile and laugh. But if you're subconscious all the time about that, you're not going to, then you're subduing all of the good things, in your life. And we all should be happy, and we all should be able to smile really big. So I think that if people aren't happy with it, it is an investment usually to do something like that, but you're investing in yourself. I feel like it's of course I do, but I feel like it's a great way to, invest in yourself, because you see the after, and they are just so happy. And of course they say, I wish I'd have done this. Like we all do with something, like, oh, I wish I'd have done this so much earlier in my life. I wish I'd have known this would be so great. So people, you can really change some lives with a smile. It's pretty nice.
You are a member of multiple professional organizations. Is that correct? And can you tell us a little bit about what those are?
Yeah, well, most of us, we do the Baton Rouge Dental Association in the Louisiana, and then the ADA. They're just great resources to be able to connect with all the dentists in each spot. So just Baton Rouge dentists will connect, then we connect with Louisiana, and then we connect with the national dentist. And then, the Invisalign, there's clear aligners. So in the group with the clear aligners, and then we could go and learn more. You just, now with all of the WhatsApps and the Zooms and all the things that we have together, and Facebook pages, you can ask a question to somebody in Australia, or like
right.
all over the world at one time. Like, you put it out there, you'd be surprised how many answers you get back. So being involved in a lot of these groups has gotten really great, because where we used to have to wait to meet up with a person or know the person enough to, and ask the question or hear their story. Sometimes you don't even know, we don't know. You hear their story and you're like, oh, wow, I wish, now I'm thankful that I heard that. Now with my patient, I will be able to do X, Y, and Z. So I'm in, a lot of them. There's a facial aesthetics group, a lot of dental groups. I do the mastermind groups where we meet up together, and that's the same thing. It's not so much like a class where you learn, but each person kind of gives their talk about kind of how their life is going, the things that are happening. And then it just snowballs into so much stuff that you can learn from other people, and not just in dentistry, but, life in general. When you talk to other people, you see that there's so much more that we can all learn at any age, all the time. So that's it. You're not learning, you're dying. You're not, you gotta keep going. You gotta keep moving your brain. But yes.
When you're with these, when you're in these groups and you are, like you mentioned, keep learning, What insights or trends in the dentistry space do you see on the horizon? Is there anything sort of shaping the industry right now?
There is. I do think probably sleep is probably the biggest one that, you know, you had to do just a sleep assessment and like there'd be sleep doctors, very few sleep doctors. I think dentistry is a great place. And that's kind of where it started. We're like, hey, we're in the mouth all the time. We're in the oral cavity, in the airway space all the time. And so they've really been pushing for us to do that as standard of care for us, is that we should be at least looking at it, at least talking about it to every patient, which is great. So I think that has gotten to be easier and definitely at the forefront of here's your dental stuff, but then remember you're in the mouth and be able to check and see if these people are breathing. So that's a huge one. I do think gum disease has always been kind of a big thing. A lot of people kind of push it to the side, but the bacteria that causes the gum disease now is almost the same thing as the sleep. We're finding a lot of correlation between. We always knew it caused heart disease. Even when I was in school in the 90s, they were teaching us that heart disease, it'll cause miscarriages for women. It's the same bacteria that's in our mouth and our gums. It's systemic. Obviously, you eat or drink, anything that's in here is going to go systemic. Right. And it'll blockage for hearts. It will cause issues with if you have like a joint replacement, those kind of things where you don't want those things to get infected. Well, that's a bacteria in your mouth that's an infection. And it causes all systemic things to happen across the way. So it's really huge. And it's sad that we're finding out more patients are having it, maybe a little more just because our life's so busy and the cleaning and all the things that, even though we have so many ways to clean our teeth, the stress, the medication, a lot of medications that a lot of people are on, anti-anxiety, depression medicine, any of those ADD medicines that all of our kids are on pretty much, terrible. You get dry mouth. Well, if your mouth is dry, you don't have the saliva to rinse out this bacteria and get rid of it. So it stays there. So then when you eat food, you drink your drink, then it's more systemic. So all of these things have caused us to really see more periodontal disease, but the insurance companies are paying less for the periodontal disease and denying it more. They're denying a bunch of stuff. Now they just don't want to pay. They got to pay for their yacht or something. I don't know. But it's so frustrating because these patients then tend to feel like, well, if my insurance doesn't cover it, I shouldn't do it. So frustrating for all of us. Dentists and medical professions probably the same. It's like, no, if I'm telling you this, you need it. Whether they in the corporate building over there tells you that you need it or not. But also people financially have to rely on some help from their insurance company. So an insurance company denies 50% of a bill, it's huge. So I get it from both sides that it's, it could be an issue, but it is a problem that we're seeing in the dental field a lot, is that insurance companies are starting to deny more things, and it's only hurting the patients that are paying insurance bills. I pay my insurance. I don't pay dental insurance, right? So it's not helpful. Right. It's only hurting my patients and all of our patients. It's really frustrating, but that's something we all try to figure out how to contend with and not end up like the medical profession where they're just pretty much run by the insurance company. The insurance company is trying to run us and we're trying to fight for the patients. So that's another thing that we talk about a lot, but trying to keep those, the gum healthy, the snoring part healthy. And then the only other thing I know now is pretty big, and I'm doing a lot of research on it, is the microbiome, the oral flora, kind of that same general scenario where are we taking too much out? And then so systemically, is it hurting us? We can do swabs, it's expensive. So I'm trying to figure out how we could do this without costing the patient a fortune, but swabbing for so many things, you can swab and know, are you predestined for stroke, heart attack, dementia, Alzheimer's? Right. So they're just still really expensive. So I think that's going to be something that we're going to probably be able to do more prevention by just swabbing in the oral cavity and telling you whether you are predestined for periodontal disease. So let's, stay on top of this. For the heart attack, the stroke, dementia, Alzheimer's, there was a few other ones, even like the miscarriages. There's a few other things, stomach problems, and some cancers. So it's pretty interesting. When you think about it, everything goes in and out of this little area right here. So it's kind of an important spot to take care of.
We talk about this kind of a bit on the show, with a bunch of different industries, but I'm interested, Do you see AI as having any impact in the dental space?
Yes. I mean, so we do have AI now, and it's on our dental x-rays. So it pops up and it shows cavities, and it shows
Oh,
calculus,
wow.
the stuff that goes under the thing, under your gum, the bacteria. It shows like margin discrepancies. So it's, I would say maybe I'm still skeptical. I mean, I know AI is super smart, right? It's very good, but I also was on the other side of it, and one company approached me to help with assessing it. So what they have to do is they send the x-rays to me, and I have to say, this is a cavity, this is calculus, this is this, right? And you mark it. And that's how AI knows. A human has to tell it
Right.
first. So
Right.
you still have some human error in there a little bit. But overall, it's a great way to catch your eye on something that you might have missed. And like, oh, wait, why is that pink? Let me look at that tooth again and make sure that and I'm not seeing it. So I second guess AI. I mean, it has to be both ways. It has to be on AI on my x-ray. I have to take it off and see it. And I have to see it, some evidence of it in the mouth. I don't just say, AI is so smart. They're not just Google. No. It is in the business. And it's, yeah, I don't know. It's exciting to see. They'll show like bone loss. It'll measure that. And we're getting somewhere, you know? So it's kind of nice to see it. It's helpful.
Wild. That's pretty wild that that's come that far.
Yeah, it is. It is. It was
scary.
Yeah, and scary. So like, yeah, if you're out there, you have some AI, just check it. Just to do some x-rays.
So I'd love to talk about you a little bit more before we, wrap things up here. You're very active in your community. Can you speak a little bit about that?
Oh, wow. Let's see. Which one do you want to know about?
Tell me a little bit about the Susan G. Komen Foundation. I'd love to know more about that. I'd love to know more about the Big Buddy program.
So most of all of that is dancing involved. So I give a lot of time as a professional dancer to these events where they raise tons of money. So we have one coming up in July. No, actually, Dancing for a Big Buddy is coming up in April 26th, I think, is Dancing for a Big Buddy. And that is the same thing. If professional dancers dance with star dancers, the stars raise money for the Big Buddy Foundation in Baton Rouge. And so it's really nice. And the people get to dance. It's a fun event for everybody to go to. They do one in Ascension Parish now too, which is Dancing for a Cause. And so that's one that I'll be doing this year with 3 partners. And it's really, it's just a fun way for us as professionals to keep dancing. The stars to get out of their comfort zone and do things that at first they're like, I don't know why I signed up. I don't know why I signed up for this. And then they finish as like rock stars. They're like, I want to dance again. This is the best. So it's so fun to see. And they all raise money for a really good cause, obviously. And the same thing with Susan G. Komen. There's usually like an auction, and we get to do some little fun dances, stuff there and there. Those are the fun dancing ones. And then I did start a mission. So I have the Smile Spot has a mission, a nonprofit. And we just did our first trip to Nepal.
Oh, wow.
And I was the only dentist. So it was me and my youngest son and my husband, and then a friend of ours. And we went to this one spot in Nepal where my son and the other lady had been. We now call her Dr. Pam. She says she's a doctor. We have converted all of them into doctors. They were so helpful, but it was so nice. So we want to be able to do that and go to other places and be able to give services and do some dentistry. I mean, these people have never seen a dentist, a lot of them. And one lady walked 7 hours to see us in Nepal.
Oh, wow.
The mountain down, had to sleep there that night, and then was able to walk back. So it was it was so good. It's kind of those things they say, it's better to give than to receive. You're more blessed to give than to receive. And you definitely, you're giving and you're tired, you're all day long. And then the stories that they come back with are just their smile that they never had before. Clean teeth for them is huge. So them healthy. So I'm hoping to do a lot more of those in the future, is be able to go out and do some. And then we're also I'm pairing with the people here in nonprofits to take care of local kids who are having to live with their grandparents, to maybe get them some braces, things that their grandparents may not be able to afford, but we could do for them so that they are not, even more feeling more outcasts, that they could be just like a normal kid. And I'm probably doing some other events with them soon, some other nonprofits where we can try to help the people that are local as well. So not just going out, but the mission here is to, help the local people that need help also. And I go to Bethany Church, and we have a lot of missions, and we do, a lot of days where we really go out and serve the community. And it's good to give. It really is. It's get your mind in the right place. Everybody should do it.
Well, Dr. Aimee, this has been an absolutely incredible conversation. Thank you so much for coming on the show. If anybody out there listening could use your help, could use the help of the Smile Spa, where can the people find you?
You can go to the website. It is, there's one, drrussosmilespa.com, and then there's the smilespa.us. Both of those wind up in the same place. There's Smile Spa Missions, and the office is on Jefferson. Our phone number is 225-292-7645. You can Google us, look us up. I appreciate it. It was great. Thank you. It was so painless.
Thank you so much for coming on the show. This has been great. Thank you so much.
Welcome. Thanks.
And thank you, everyone, for listening. This has been Partnerships for Profit, presented by LeDuc Entertainment. Dr. Aimee, thank you again.
Thanks for joining us on this episode of Partnerships for Profit. We hope you've gained valuable insights on how to form profitable partnerships and take your business to the next level. Be sure to subscribe and leave us a review wherever you listen to podcasts so you never miss an episode. Got a partnership story to share or someone you'd like to see featured on the show? Reach out to us. Until next time, keep building those partnerships for profit.